Hello everyone, happy evening, a very good evening. Welcome to episode 2 of C3 with N3, that is Cheat Codes and Concepts to Crack NEET PG with Dr. Nikita Nanwani Nathani. And in our today's episode, we have a very important topic to discuss, that is the thalamus. So before I proceed with this session, can you give me a quick nod whether I am audible and visible? The audio visual is good? That's great. So, why did we decide to have this topic is because I got a request from some of the students to simplify the topic of thalamus, the nuclei and its connections. So, quickly we will see, the important points about thalamus. So, when you're preparing for competitive exams especially, you need to understand that, there are some areas which you need to focus on in that topic. Like you should know that these are the questions which are asked. These are the points which are important for MCQs, and that is what the whole agenda is for the class today. So we will see what all are the possible questions that can be asked on thalamus, right? So I hope all of you are excited about today's topic, and we'll try and simplify this topic for all of you. Yes, happy evening, Rizwana, and everyone, happy evening. So I hope all of you are connected with us on the Telegram group as well. That is Dr. Nikita's Rad Synapse and Unacademy NEET PG Telegram group as well. And you can access all the sessions that I've taken up till now on Unacademy on my profile. The link is given here. And after this, the next session that you have, the schedule for this week is, so today we are having this session. Tomorrow, 19th August, that is from 6 to 7 p.m. Again, there's a free class. That's a special class on the Unacademy app. It is Kaun Banega MD Season 2, Episode 3. And I hope all of you know the topic is Rickettsia, Chlamydia and Mycoplasma. So you will see 15 questions from rank 50K to rank 1. I'm sure all of you are enjoying this series as well. Then after that, on day after tomorrow, 20th, we will be having the session 3 in toxicology, which is only for the subscribers. So if at all you are not subscribed to Unacademy and you want to learn toxicology in a fun way, you may consider subscribing to Unacademy using the referral code Dr. Nikita. And this is the schedule for the rest of the week. So this month you have many free classes and the plus courses as well on your way. If we have students who are appearing for FMG December 2020, we have started as a course on 17th of August, and it will go on till 12th December. And for NEET PG 21 students, again we have started a course 17th of August. So I've been getting queries from the students who have just started now due to some personal reasons, work issues, family issues. So if you're one of those, this is the course which you should watch the lectures sincerely, follow the schedule, and by the exam comes you would be done with all the syllabus and the MCQs. All right, so let's start with our today's session. Quickly, since I'm a radiologist, so I'm starting with this radiological image. Can you tell me what is the investigation and what is the arrow pointing to? Yes? What is the investigation and where is the arrow pointing to? So I hope all of you can identify. We have had enough of this radiological images in the Radiology Spotters every Monday 6 p.m. series as well, right? This is MRI and this is pointing, the arrow is pointing to thalamus. If I ask you which sequence in MRI is this? This is a T1 weighted MRI because you can see the white matter here, which is the corpus callosum, which is white. So white matter is white, anatomy is followed in T1 weighted sequence, and you can see that this structure here, which you can see, that is the thalamus, right? That's the thalamus. What is this structure here? Can someone tell me what is this rounded structure there? No, Kiran, worry not. We were a bit delayed in starting the session, so we have just started. Worry not about it. So this rounded structure here is your mammillary body. Okay, that's the mammillary body. And this is the cerebellum. Just a quick revision of anatomy. It was asked in the recent NEET exam. That's the cerebellum there. You all can see that that is the cerebellum there. And this is the fourth ventricle. this is the pons, this is the midbrain, and this is the medulla, right? And this is where you see the midbrain. These are the colliculi in the midbrain, right? And this part which you see coming here, that is called as, this has been asked many times, it is the fornix. Okay, that's the fornix. Where is the pineal, Asha? Pineal will come here. Okay, the pineal gland will come here. I'll show you some more images as we go through this session, right? So now let's answer this question. True about thalamus. Which of the following is true about thalamus? Is it a motor gateway from the cortex? Y-shaped band of fibers divides the thalamus into 4 subdivisions. It is the largest part of diencephalon. It is the sensory gateway to the cerebral cortex. Absolutely right. It is the sensory gateway. So whenever we say thalamus, the first thing that should come to your mind is that it is the sensory gateway. So all the sensations, the afferents, they pass through the thalamus and then they go to the cerebral cortex, right? And there is one exception. So please add this one-liner to your notes if it's not there in your notes. Which sensation? All sensations, afferents, pass through the thalamus except one, which is that. Very good, Jayansh. Absolutely right. That is what I was asking. That is olfaction. Okay. So olfaction indirectly passes, but not directly. The afferents do not go through the thalamus. So remember, the exception is olfaction. Now, motor gateway, no, it is the sensory gateway. What is incorrect in option B? So we know that there is a thalamus, there's thalamus, and there is Y-shaped band of fibers. It divides the thalamus into 3 subdivisions, not 4 subdivisions. So again, important point that it is divided into 3 subdivisions. It is not the largest part of telencephalon. It is the largest part, but of diencephalon. Not of telencephalon, it is of diencephalon, right? So if this is a question which comes in embryology, again very important, optic cup develops from telencephalon, diencephalon, metencephalon, myelencephalon. What will be the answer to this? So optic cup develops from, remember, diencephalon. It develops from diencephalon. Again, an important question and it is frequently asked. So your optic structures, so you can see that in the primary vesicles, when the brain is developing embryologically, you have prosencephalon, mesencephalon and rhombencephalon. Prosen then divides into telen and dien. So in the dien, you have all the thalami wale structures. Epithalamus, subthalamus, thalamus, hypothalamus. Plus you have the mammillary bodies, hypothalamus ke saath neurohypophysis, the posterior pituitary, also the pineal gland and all your, ICA structures. So retina, iris, ciliary body, optic nerve, optic chiasma, optic tract. All these are also from diencephalon. So please remember, eye structures are also from diencephalon. Very, very important to remember. Now, if I ask you a question here, if you see this sagittal section of the brain, we see habenular commissure here, right? We see this habenular commissure here. So, habenular commissure, is it a part of thalamus, hypothalamus, epithalamus, subthalamus, metathalamus? Habenular commissure is a part of absolutely right. It is a part of epithalamus. So remember that habenular commissure is a part of epithalamus. Also, what do you see here anatomically? What gland comes here in close relation inferior to the corpus callosum here? Pineal gland, right? So the pineal gland also comes here. So your habenular commissure, posterior commissure, pineal gland, these are all epithalamus ke structures. Remember, they are all epithalamus ke structures. Now coming to the division of the thalamus. Coming to the division of the thalamus. So what we see here, that this entire thing is the thalamus. You can see this Y-shaped structure. You can see this Y-shaped structure which divides the thalamus into 3 parts. This Y-shaped structure, what is it? It is called as internal medullary lamina. It is the internal medullary lamina. So remember that thalamus ke andar is internal medullary lamina. So where is the external medullary lamina? If internal medullary lamina is interior, external medullary lamina will be external. In what relation to the thalamus? Is it medial to thalamus, lateral to thalamus, anterior to thalamus? Where is it present? Absolutely right, Jayansh. So it is present lateral to thalamus. Okay, it is present lateral to thalamus. Now this internal medullary lamina, these are the white fibers. So it is a band of white fibers dividing into three parts. You can see the one is the anterior part, you have the medial part, and you have the lateral part. So you have anterior, medial, and lateral. So the questions that can be asked on this, which is the largest subdivision of the thalamus? Anterior, medial, or lateral? We all can see here that the largest subdivision here is, largest is lateral. So it is the lateral which is the largest, right? It is the lateral which is the largest. Now, since lateral is the largest, so the nuclei which you have in the lateral part, they are divided into two layers. Okay, so you have the ventral tire and you have the dorsal tire. So these nuclei which you see upper lateral part mein, this is the dorsal tire. These nuclei which you see niche, this is the ventral tire. So in the lateral part itself, you have two subparts, that is niche ventral and upper dorsal, because it is the largest. Anterior mein you have only one, which is the anterior nucleus. Medial mein you have the dorsomedial nucleus, right? These are the important nuclei. Now in the ventral tire, in the lateral part, okay, so you can see that सबसे पहले आगे is anterior, ठीक है? So सबसे आगे is anterior, सबसे पीछे will be posterior, और बीच में रहेगा intermediate, and in between there will be intermediate. So you will have सबसे आगे ventral anterior nucleus, सबसे पीछे you can see this is the ventral posterior, and बीच में it is ventral intermediate, or it is called as ventral lateral also. Okay, so ventral lateral or ventral intermediate. Why is it important to know this diagram? Because they can ask you an image based question, and they can put an arrow and they can ask you this nucleus receives which fibers. That is why you should know how to identify the various nuclei. All right, so is it clear with everyone? So this is ventral anterior, ventral lateral or intermediate, and this is ventral posterior. Even in ventral posterior, it is divided again into medial and lateral. So you can see here ventral posterior medial, and this is ventral posterolateral. Okay, so you have ventral posteromedial and ventral posterolateral nucleus. ठीक है? And dorsal में what nuclei do you have? You have lateral dorsal nucleus, lateral posterior nucleus, and you have the pulvinar as well. You have the pulvinar as well. So if the question is, which is the largest nucleus of thalamus? Which is the largest nucleus of thalamus? From the image you can see which one looks the largest. So you can see this nucleus here, which is the largest. So remember that the largest nucleus of the thalamus is pulvinar. Now just below the pulvinar, you can see these two rounded bodies. These are your medial geniculate body and the lateral geniculate body. So some books also mention that this medial and lateral geniculate body, they are not parts of the thalamus proper. They are not parts of thalamus proper. These are parts of what thalamus? Is it subthalamus, hypothalamus, epithalamus? These are parts of, yes. So please remember, these are parts of metathalamus. This has been asked previously. So remember that the geniculate bodies, these are parts of metathalamus, not sub or epi or hypo. These are parts of metathalamus. So one point again to be added to your notes. Now, when you have the two thalami, let me show you another image as well. Yes. So have a look at this image. Okay, so you have this two thalami. Okay, so we have two thalami, one and two thalami. So these two thalami, they are connected by this massa intermedia or the interthalamic adhesion or the interthalamic connections. Okay, and you can see now, you can identify the parts of the thalamus. This is one part which is anterior. This is the medial wala part. So this is your dorsomedial, and this one, the largest one, is the lateral part. The largest one is the lateral part. In the lateral, here you have the dorsal tire. Okay, and you have बाद में बाजू में you have the ventral वाले nuclei. So ventral anterior, सबसे पीछे you have ventral posterior, उसके बीच में ventral lateral, and you can see this largest nucleus here, which is the pulvinar. You can see the largest nucleus here, which is the pulvinar. All right. So, and this Y-shaped structure you can see, that is the internal medullary lamina, right? That's the internal medullary lamina. So remember that the two thalami are connected by the massa intermedia or the interthalamic adhesions. All right. And apart from these nuclei, apart from this nuclei, the internal medullary lamina contains the nuclei, as the term says. Which nuclei will it contain? The lamina will contain the intralaminar or the laminar nuclei. Okay, so it will contain the laminar nuclei. It will contain the laminar nuclei. Now, which is the largest laminar nucleus? Which is the largest laminar nucleus? Remember, there is something called as centromedian nucleus. There is a centromedian nucleus, which is the largest laminar nucleus. What we did miss is there is one more nuclei. Can you tell me, there are these nuclei which are present here? Thalamus ke baaju mein. These are the only nuclei of thalamus which do not project to the cerebral cortex. Which nuclei are those? Those are the reticular nuclei. Those are the reticular nuclei. Absolutely right, Jayansh. That is reticular nuclei. So Jayansh seems to be very good with thalamus. Now, some more one-liners to be added to your notes. That thalamus is covered on its superior surface by a thin layer of white matter, which is called as stratum zonale. Now, this can be asked as true or false statement as well. So, is stratum zonale present superiorly or inferiorly? So remember, if this is the thalamus, uske upar you have the thin layer of white matter, which is stratum zonale. Uske laterally is the thin layer of white matter, which is external medullary lamina, and thalamus ke andar is your internal medullary lamina. So the external medullary lamina is present on the lateral surface. It is the white matter on the lateral surface. Internal medullary lamina is your Y shape, which is present in the thalamus, right? Now, this again, this is from the radiologist point of view. We have already discussed that this nucleus here is your pulvinar. This is your dorsomedial nucleus, and this is your FLAIR MRI image. Can you see some hyper intensity in the FLAIR MRI image like this? There is this abnormal signal affecting the dorsomedial nucleus and the pulvinar. What sign is it called as? What sign is it called as? Yes? Anyone? What is the diagnosis and what is the sign? You can see bilateral thalami. These are the thalami that you see here. What is the sign and what is the diagnosis? Anyone? Very good, Gagan. Absolutely right. So that is the hockey stick sign, right? That is the hockey stick sign. Where do we see the hockey stick sign in ECG? Digitalis toxicity. On MRI in brain, it is in the, what is the diagnosis? Creutzfeldt-Jakob disease. What type of Creutzfeldt-Jakob disease? What sporadic variant? What type? It is present in variant CJD. Each of these is an important point and potential questions that can be asked. Okay. So remember, it is seen in variant CJD. So you can see here that it is affecting the dorsomedial nucleus and the pulvinar. Okay. So if they ask you, Hockey stick sign, the other name for hockey stick sign, it is also called as pulvinar sign because it is affecting the pulvinar, all right. Coming to the next question here, pain and temperature in thalamus. This is like a pre-test assessment for all of you. Then we will see the connections in the thalamus, the inputs and the outputs. Pain and temperature in thalamus is controlled by which nucleus? Is it ventral posteromedial, ventral posterolateral, anterior or posterior? Okay, so the correct answer here is VPL, that is the ventral posterolateral. So if ventral posterolateral is your pain and temperature, what is ventral posteromedial for? Ventral posteromedial receives sensations from which part of the body? So ventral posteromedial, remember that it is for the sensations from the face, and ventral posterolateral is for the rest of the body. It is for the rest of the body. Okay. So from the face, that means which nerve? Sensations from the face. So you will see trigeminal. Okay. Trigeminal lemniscus will come into VPM, and special sensation also, special sensation from the face, that is from the tongue, that is taste, also comes in your VPM. So trigeminal and taste, they come in VPM. So this is called as which pathway? Your gustatory pathway. Can you tell me the tract for gustatory pathway? What tract is it? They can twist the question and they can ask you in that way. So remember that the tract, first of all, let us see the nucleus. What is the nucleus for taste? Which nucleus is it? Is it nucleus ambiguous? Which nucleus is it? Very good. It is nucleus tractus solitarius. So this nucleus tractus solitarius कौन से tract में से जाता है? It is your central tegmental tract. Okay. So remember that they can ask you an indirect question. Central tegmental tract, it gives fibers to the VPM because it is taste. So this is easy to remember, as you can see here. So taste is tractus solitarius and it is the tegmental tract. So remember the T's. And along with taste goes another T, that is trigeminal tract, and all of these are your ventral posteromedial, and ventral posterolateral is the rest of the body. So to remember, have the schematic diagram in your mind. Okay, so imagine that these are the two thalami and the person is lying like this. Imagine from an action movie, someone is doing a stunt like this. The person is horizontal, the head or the face is medially and the rest of the body is laterally. Okay, so you will remember this as that the medial one is for the face and the lateral one is for the rest of the body. So the medial one is for trigeminal and taste, and lateral one, so in the lateral one you will have which lemnisci? Which lemnisci will come? So from your dorsal columns medially located, so medial lemniscus, spinothalamic tract, there will be your spinal lemniscus. Alright, so you will have medial lemniscus and the spinal lemniscus. Clear with everyone? So have the schematic diagram in your mind forever. Ki face, two people coming close together, face close together, so they are medially, the face is medial and you have the rest of the body laterally. This is very, very important. Most frequently asked question in thalamus would be this. Okay, now the next question, thalamus and hypothalamus, they are present at what wall of the third ventricle? Anterior, posterior, medial or lateral? What wall of the third ventricle? If you have the image in your mind, anatomy is all about images. You don't have to mug up anything at all. So if I go back to the image where we saw the thalamus, okay, let us see this image. Now in this image, where do you see the third ventricle? The slit-like structure in between, that is the third ventricle. That's the third ventricle there. And on either side of third ventricle, you see the thalami. Okay. So this slit-like structure, this is the third ventricle and these are the two thalami. So you can see that the thalamus is present on which wall? Now you can identify. It is the lateral wall, right? It is the lateral wall. So keep this images in mind, then it becomes very easy to answer. So it is the lateral wall of the third ventricle, okay? Next question, relations of internal capsule are. This is a previously asked question. So relations of internal capsule, what is medially and what is laterally? Out of thalamus, caudate and lentiform. What is the correct answer here? Anvesha says A. Until and unless you are familiar with the images, anatomy becomes difficult. Yes, the correct answer is C. The correct answer is C. Let me take you to that image again. So now can you see in this image, where is the internal capsule? This is where you have the internal capsule. This is the internal capsule. What is this structure here? Adjacent to lateral horn. We have seen this in radiology sessions already. This is the caudate nucleus. This is the thalamus. And lateral to it, that is where you have the lentiform nucleus, right? So you can see that if this is the internal capsule, caudate and thalamus, both of them are present medially and lentiform is present laterally. Lentiform is present laterally, right? So that is why the answer will be C. So you have caudate, you have thalamus and you have the internal capsule like this. And lateral to that you have the lentiform nucleus. Okay. So thalamus and caudate nucleus medially and lentiform nucleus posteriorly. Lentiform nucleus posteriorly. Now this is a question which was asked in AIIMS 2016. I've just put the image. The question was identify the insula. Which structure here in the image you see that it is insula? Very correct. So this is the insula. What you see here, insula is this part of the brain. We have seen in radiology sessions, insula matlab island. So it's the island of the brain where you have the three lobes coming together. So this is where you see this structure C. This is the insula, right? And if the question now is which structure is the thalamus? Which structure is the thalamus here? Right? It is structure D. It is structure D. So D is the thalamus. Right? D is the thalamus here. You can see the caudate nucleus here. You will see the internal capsule going here, right? And this is where you have the lentiform. So you can see that caudate and thalamus are present medially. Is it clear with everyone? And what is this structure? Slit-like structure in the midline. That is your third ventricle. So thalamus is present lateral to the third ventricle. All right. This we have already seen. Medial and lateral geniculate bodies are part of. Medial and lateral geniculate bodies are part of metathalamus. They are part of metathalamus. All right. They are part of metathalamus. So components of diencephalon, it is thalamus, hypothalamus along with the posterior pituitary. Epithalamus, we already saw the most important to remember, habenular commissure, posterior commissure and the pineal body. They are parts of the epithalamus. You have subthalamus and in metathalamus you have medial and lateral geniculate bodies. Alright. Now coming to the most important part in thalamus, which is very confusing, is your connections. The connections in the thalamus. Okay. Alright, so look at this image. So in this image, you see this Y-shaped, that is your internal medullary lamina. So this becomes your anterior nuclear group. यहाँ पे छोटा वाला is your dorsomedial and the largest one is the lateral. In the lateral you have ऊपर the dorsal वाला tire and नीचे you have the ventral वाला tire and सबसे बड़ा nucleus of thalamus, that's the pulvinar, right? That is the pulvinar. Ventral posterior is divided into VPL and VPM. Now in this image, if I have to label again, so this is anterior, this is dorsomedial, the largest one, this is the pulvinar. Ventral में we have ventral anterior, ventral lateral or ventral intermediate, and we have ventral posterior, right? And we have ventral posterior, जिसमें we have ventral posteromedial and ventral posterolateral, right? So now most important things, the questions which are asked are anterior में what are the connections, the fibers. So you can see that in the anterior, what comes in the anterior is your mammillothalamic tract and the fornix, right? So we saw the fornix in the first image of MRI and we saw the mammillary bodies also. So this is very important to remember that the mammillary bodies, mammillothalamic tract, it goes to the anterior nucleus. So how do we remember this is, so remember that mammillo, from mammillo, we remember basically, mammary or the mother. So always the mother comes the first. Okay, so mammillo or mammary, that is the mother, it comes the first, that is anterior. Now this also forms part of which circuit? This is a question which I remember was asked, during our times as well. So this is a very frequently asked question. Which nucleus of thalamus forms a part of Pape's circuit? ठीक है, तो mother और papa ये साथ में याद रखना. So you have mother, you have mummy and you have papa. They both come in the anterior thalamic nucleus. ठीक है, so mother and father, anterior thalamic nucleus, that is the Pape's circuit. Okay, now the outputs from the anterior, they go to the cingulate gyrus. They go to the cingulate gyrus. So remember mother, father, mother, papa and single. Cingulate is single. Okay, so remember that before becoming mother and father, we are single. Okay. So this is your anterior thalamic nucleus. Is this clear with everyone? So anterior, यानी सबसे आगे, the most important role in our life is mother, that is mammillary. It is Pape's, and before that it is single. So mammillothalamic tract and cingulate gyrus is the anterior nucleus of thalamus. Coming to the dorsomedial nucleus. Dorsomedial nucleus. Most important to remember here, dorsomedial nucleus, it has connections, inputs from the amygdaloid temporal neocortex. So basically you have to remember that it gets from the medial temporal lobe. So amygdala and temporal, and the output efferent is to the prefrontal cortex. It is to the prefrontal cortex. So to remember this, what do we remember is कि dorsomedial, it is the dorsomedial nucleus. And when you have the image, let me see if there is an image which I can show. Okay, I don't have the image proper which I can help you with here. ठीक है, तो इसमें dorsomedial में remember that when we always talk of the disease which is mesial or medial temporal sclerosis. I hope all of you have heard of this, mesial or medial temporal sclerosis. So medial में जाता है temporal lobe, that is medial temporal sclerosis. And we all know that this medial temporal lobe, amygdala, these are the ones which are associated with emotions or the limbic system. So if they ask you the question which nucleus of thalamus has control on emotions or limbic system, it is your dorsomedial nucleus, and then it goes into the prefrontal cortex. Then it goes into the prefrontal cortex. The next ones are your ventral nuclei. In the ventral nuclei, VPM and VPL we already saw. What did we see about VPM and VPL? We said that medial wala is your face and taste. Lateral wala is the rest of the body. So in the medial, this is your VPM where you see. So you will have trigeminothalamic tracts. You will have trigeminothalamic tracts. And you will have the taste pathway. So nucleus tractus solitarius and central tegmental tract, that goes to VPM. So VPL में क्या जाता है? The medial lemniscus and the spinal lemniscus. Now both of these, these are the main sensations of the body. So which is the main sensory cortex, the area in the brain, in the cerebral cortex? Is it the precentral gyrus or is it the postcentral gyrus? Precentral or post-central? Which is the sensory cortex? Pre or post? It is the post-central gyrus. Okay, post-central gyrus. Yes, areas 312. So it goes to the areas 312. You have to remember the Brodmann areas also. Maybe we will have sessions sometime later on Brodmann areas also. So remember, sensory is posterior. Sensory is posterior. Motor is आगे. Precentral is the motor. Now, in the rest of them, in the ventral, what are the important ones to be remembered? You have ventral anterior. Very, very important to remember. Your globus pallidus, the only basal ganglia which gives efference, is your globus pallidus. We have seen in one of the episodes also, I think KBMD mein, embryology mein, globus pallidus is the only basal ganglia that develops from diencephalon, Rest of the basal ganglia, they are from telencephalon. So it comes, globus pallidus comes from the diencephalon. That is why it is connected with the diencephalon, that is the thalamus, right? So globus pallidus is the one which goes to the ventral anterior and the substantia nigra also. You can see globus pallidus and substantia nigra in ventrolateral also. But important point to note here, please make a note of this, that ventral lateral is equal to your ventral anterior ke connections plus the dentate nucleus. So dentate goes in your ventral lateral nucleus. Okay. So VL mein jata hai dentate nucleus from the cerebellum. Alright. And this one is your pulvinar. The largest nucleus is your pulvinar. It goes to the inferior parietal lobule. Not that important. You can skip that. The next thing that is important to know here, so you have the medial geniculate body, right? You have the medial geniculate body and the lateral geniculate body. What is the functions of these? Very, very important. Medial geniculate, lateral geniculate, parts of metathalamus. So medial geniculate body, it is your auditory pathway. Lateral geniculate body is your visual pathway. Medial auditory pathway is which colliculus? Inferior colliculus or the superior colliculus? Inferior colliculus or the superior colliculus? It is the inferior colliculus, and visual is your superior colliculus. Yes. So what are the cheat codes to remember this? Because we tend to get confused. So medial and lateral. Okay. So remember M for music, as rightly mentioned by one of the viewers here. So music is sound. So it is auditory. Lateral is light. L is light. So it is the visual. Eyes, ears or eyes mein, which is located inferiorly. The ears are located inferiorly. Eyes are superiorly. So inferior colliculus is auditory and superior colliculus is visual. Clear with everyone? Right? So medial, auditory and colliculus. So if you have, I hope all of you know the mnemonic for the auditory pathway also. What is the mnemonic for the auditory pathway? To arrange the auditory pathway, what does S stand for? You have slim. What does slim stand for? So S is your superior olivary nucleus. What does L stand for? What does L stand for? Lateral lemniscus. Lateral lemniscus. Then is your inferior colliculus and then is your medial geniculate body, right? Then is your medial geniculate body. So please make a note of this here that it is lateral lemniscus. So lateral lemniscus, if they ask you that which of the following lemniscus does not go to the thalamus proper, trigeminal lemniscus, medial lemniscus, spinal lemniscus or lateral lemniscus, It would be lateral lemniscus because it goes to the medial geniculate body, which is a part of metathalamus, right? And where is the auditory cortex located? Superior temporal gyrus or inferior temporal gyrus? Where is it located? It is the superior temporal gyrus. It is the superior temporal gyrus where you have the auditory area. It is area 41 and 42. Optic tract, visual mein you have the visual cortex in the occipital lobe, that is your area 17. I'm not going into Brodmann areas today. We'll see some other time. So let us quickly revise what did we see about the tracts. Right? The most important ones that we saw here, ventral posteromedial. So it is trigeminal and solitario matlab taste. Ventral posterolateral is medial lemniscus and spinal lemniscus. Point to be noted that lateral lemniscus goes where? Where does lateral lemniscus go? Lateral lemniscus, auditory pathway, so it goes to the medial geniculate body. Ventral anterior, we saw ventral anterior, ventral lateral. They will have your globus pallidus, right? It comes through the subthalamic fasciculus. And your ventral lateral will have from the cerebellum as well. So dentate is from the cerebellum. Medial geniculate, inferior colliculus, auditory fibers. Lateral geniculate light is optic tract. Medial geniculate will go to the auditory area 41-42. Light will go to the visual 17 area. Now, these are your major sensations, the VPL and the VPM from the face and the rest of the body. So, they will go to the post-central gyrus, which is the sensory cortex, that is areas 3-1-2. And your ventral anterior, ventrolateral, these are from the basal ganglia, lobus pallidus and the cerebellum. So that means basically they are controlling the motor part, the movements in the body. So that is why it will go to the premotor and the motor areas. Okay. So your ventro-anterior and ventrolateral, जो आगे वाले दो हैं, VA और VL, they are your motor component. Your ventro-posterior, VPM and VPL, they are your sensory component. So sensory is piche, so it is your post-central gyrus. Motor is aage, you have pre-central, aage pre-central gyrus, so you have motor area and the premotor area. Is it clear with everyone? NB matlab, please make a note of it that lateral lemniscus goes to the medial geniculate body. Lateral lemniscus goes to the medial geniculate body. Next one, if we see, this is your Papez circuit, which we saw. Papez circuit, you will have fornix, mammillary body, mammillothalamic tract going to the anterior nucleus of thalamus. So mother, mama, papa and the cingulate gyrus, right? And then you have the cingulate gyrus. Coming to the rest of the nuclei, anterior सबसे आगे mammillary, then it goes to the cingulate gyrus. This is the part of Papez circuit, right? This is the part of Papez circuit. Forms emotional tone and recent memory में important है. Dorsomedial, so medial temporal sclerosis. So it is related to your amygdala and all of those. Goes to the prefrontal cortex. Right? Dorsomedial mein you have to remember amygdala, that is the limbic system. It also controls the emotions, right? Emotional feelings, very important here. Lateral dorsal वगैरह important नहीं है. Ventral हमने already देख लिया. What are the intralaminar nuclei? Intralaminar present in the internal medullary lamina. So they will have from the reticular formation, spinothalamic and trigeminothalamic. These are not really important. Most important, I'll tell you the questions which are asked. That intralaminar nuclei, they receive the fibers from the reticular formation and they influence the levels of consciousness and alertness. Because reticular formation है, तो consciousness और alertness affect करेगा. जो आपका reticular nuclei है, the output goes only to the other thalamic nuclei, not to the cerebral cortex. There is no output to cerebral cortex by the reticular nuclei, and this reticular nuclei, what is it function to the other thalamic nuclei? Is it inhibitory or is it excitatory? Is it inhibitory or excitatory? Please remember it is inhibitory. It is inhibitory, so it has the neurotransmitter which is GABA. So it is inhibitory to the rest of the thalamic nuclei. It does not give output to the cerebral cortex. It only receives inputs from the cerebral cortex. Alright. Medial geniculate we already saw, inferior colliculus, lateral lemniscus. One side, like the right medial geniculate body, will receive the fibers from both the ears, but predominantly it is from the contralateral ear. So remember that the right one will receive the fibers from both right and left, but left more than right. So contralateral side ज़्यादा है. Lateral geniculate, remember the fibers are from the optic tract, not from the optic nerve. Because in the optic nerve, you have the optic nerve which forms the optic chiasma and then it forms the optic tract. So this optic tract then goes to your lateral geniculate body. It is not the optic nerve. So please read the statement very carefully. And then we know that it goes to the visual cortex of occipital lobe, which is Brodmann area 17. Brodmann area 17, right? This I have already covered. This is just to give you a visual memory that this is where you have the central sulcus, sensory area उसके पीछे है, post central gyrus में 312. उसके आगे है motor area which is area 4, which is pre-central, और motor के आगे है premotor which is area 6. So 1, 2, 3 पीछे, then 4 आगे और उसके आगे 6. This is how you have the arrangement of Brodmann areas, right? This is how you have the arrangement of Brodmann areas. Now let me see how many of you get these questions right. Which of the following thalamic nuclei, now this is your post-session assessment. Which of the following thalamic nuclei has a motor function? What will be the answer to this? Which of the following thalamic nuclei has a motor function? Very good. Jayansh is the first one to get it right. Absolutely right. It is ventral lateral. Ventral lateral receives fibers from where? Very important, we said, remember the dentate from the cerebellum, plus also the globus pallidus and the substantia nigra. Globus pallidus and substantia nigra also go to which other nucleus? Ventral anterior. Ventral anterior. So if you get a question in the exam that globus pallidus gives output to which thalamic nucleus, you have both ventral anterior and ventral lateral in the options. Ventral anterior would be a better option to mark, okay, for globus pallidus. All right. Next question. To which of the following thalamic nuclei do the spinothalamic fibers project? Spinothalamic fibers project to which one? Absolutely right. You all have become experts in thalamus now. So it's the VPL. So remember the image. Two persons here, the face coming close together. So face is ventral posteromedial. Rest of the body, that is from the spine. So it's from the spine. Spinothalamic is in the ventral posterolateral. Your face, that is trigeminal, and the taste, that is the solitarius tract, is to the VPM, right? Next question. To which of the following thalamic nuclei do the cerebellar fibers project? Cerebellar fibers हमने देखा already. So you have VA, VL and VP. So VL में आता है cerebellar fibers, that is from the dentate nucleus of the cerebellum, right? Yes, so it is the ventral lateral nucleus. Absolutely right, ventral lateral nucleus. Now, this is a question where you have to match each pathway with the appropriate nucleus to which it gives input. So, number 1, for example, is brachium of the inferior colliculus. To which of these will it give the input? A, B, C, D, E. Brachium of the inferior colliculus will give input to. Very good, crazy for JIPMER, Neural, VN, absolutely right. It is the medial geniculate body, which is the auditory pathway. We said it is slim. superior olivary nucleus, lateral lemniscus, inferior colliculus, and the medial geniculate body. And the cortex is the superior temporal gyrus. Superior temporal gyrus, area 41-42. Thalamic fasciculus. Thalamic fasciculus or the subthalamic fasciculus. Where did we read the thalamic fasciculus? If you have heard the session very carefully, I mentioned thalamic fasciculus, thalamic fasciculus. Yes, so we mentioned thalamic fasciculus in your globus pallidus. When it goes to the thalamus, it goes via this subthalamic or the thalamic fasciculus. So it would be ventral anterior or ventral lateral. You don't have ventral anterior in the option, so the answer will be E, that is ventral lateral. Okay, ventral lateral. It is not anterior nucleus, is your mammillary. Don't confuse it with ventral anterior. Anterior is different, ventral anterior is different. Okay. Next one, mammillothalamic tract. Mammillothalamic tract, mammallo, papes, anterior, cingulate. So the answer is A. It is the anterior nucleus. Dentatothalamic. Dentatothalamic, again it is the ventrolateral from the cerebellum. Gustatory pathway, the taste pathway, which is nucleus tractus solitarius. The central tegmental tract, face medially. So it goes into your VPM. Absolutely right. Option D. It is VPM. It is VPM, right? VPL laterally is from the spine. So you have spinal lemniscus and the medial lemniscus. Yes. So that was all about the thalamus. I hope it is now easy to remember the various nuclei and the connections, right? So anterior, mammillary, papes, cingulate, dorsomedial is medial temporal sclerosis. You have to remember. So it is the amygdala. It is the limbic system, controls the emotions. And ventral may you have anterior, lateral and posterior. Anterior is from the basal ganglia, lateral is from the cerebellum and basal ganglia, and posterior is from the main sensations in the body. So it is as easy as that to remember your connections. Prefrontal cortex, efferents to prefrontal cortex go from which nucleus? Efferents to prefrontal cortex go from which nucleus? Prefrontal. We know that prefrontal cortex has a role in emotions. It is connected to the limbic system. So limbic system wala is your which nucleus? Dorsomedial nucleus. Dorsomedial nucleus. Dorsomedial nucleus, right? VN, remember VA is for your premotor and motor cortex. It is the basal ganglia, which is the motor, the movement part. So it is your premotor and motor cortex. I am saying the prefrontal cortex. So that is your dorsomedial nucleus. And cingulate gyrus, efferent to cingulate gyrus is from which nucleus? Efferent to cingulate gyrus. Cingulate gyrus is which nucleus? Absolutely right. It's the anterior nucleus. So I'm so glad that all of you have learned the thalamus. And trust me, I had to put in a lot of efforts to make all the mnemonics. I myself had to sit down and read all of this to simplify this for all of you. So I'm seeing the questions here. Episode 1, you can see on the same Unacademy NEET PG YouTube channel. Just check for C3 with N3 episode 1. I'll share the link on my Telegram group also after this session. So I hope all of you are connected with me on my Telegram group as well, and the Unacademy NEET PG Telegram group. I keep you posted. I keep you updated about my sessions on the Telegram group. And yes, so tomorrow we have the next session. It's a free session tomorrow, 19th August, Kaun Banega MD, episode 3. The topic is rickettsia, mycoplasma and chlamydia. To give you an extra edge, let me tell you, I am leaking the paper for all of you for tomorrow, that the video of rickettsia, there are 2 videos with mnemonics I've already uploaded on my YouTube channel. You can check the rickettsia video with all the cheat codes, and the extra part that you'll have to study is mycoplasma and chlamydia. Okay. Yes, Anvesha, basal ganglia is both VA and VL. But if you have both in the options and you have to choose one, then go for VA. Then go for VA. Right? And the plus subscribers, you have your next session coming up day after tomorrow, 20th August, toxicology mnemonics. We will be discussing the inorganic irritants, like your metallic and non-metallic irritants. In the first two sessions, we have seen some amazing cheat codes for your the oxalic acid, the alkalis, corrosives wala part, asphyxiants wala part, the plant poisons and the animal poisons. We have already seen the mnemonics for that. In the next session, we will see mnemonics for inorganic poisons. For students who are not yet subscribed to Unacademy, and if you are, you're really loving the cheat codes and the concepts, you can join me for my sessions on the Unacademy Plus platform also. You can use the referral code Dr. Nikita for additional discount while subscribing. So I'm hoping to see you all tomorrow in the free special class Kaun Banega MD. That's all for today. Goodbye. Take care. Keep studying, keep revising and keep winning. I'll see you tomorrow 6 p.m.